Okay, it is 1 o'clock. Let's get started. It's nice to have everybody here. Thank you so much for joining us. So just a couple of housekeeping details. If you'd like to tweet about the webinar or anything that we've shared here today, you can use @Aha Media Group. Please put your questions in the question and answer box. We will answer them at the end. You will receive an access to the recording of the webinar, and we're trying something new today. When you leave the webinar, a survey will pop up. So if you could please just take 2 minutes to answer it, it will help us make sure that we're designing webinars that really answer your questions right now. And if you have any topics that you'd like for us to cover in the future, please do let us know. We are always interested in hearing what people are looking for. So just a little bit about me. I am the president of Aha Media Group. We are a content strategy and content writing shop. We focus on the healthcare industry, and we do content strategy, copywriting, podcast and video scripting, infographics, and content training. So just wanted you to know a little bit about us. Our mission is that we empower people to make the most important decisions of their lives. Certainly in the pandemic, I think we've learned that helping people navigate healthcare situations is incredibly critical. And so thank you for being a part of our community, and thank you for all the hard work that you've been doing over the last few months. We're pretty much in awe of the heroism and bravery that you've all shown. We're not on the front lines, but we are doing our part to make sure that people can stay healthy and stay safe and stay educated about what they need to deal with. Because of our commitment to learning and growing and sharing as a community, we're excited to launch a new Zoomcast series. We are going to be interviewing leaders in the marketing as well as the healthcare marketing thought leadership space. Our first video will go out on Sunday nights. We're going to publish them. Amanda Todorovich from the Cleveland Clinic was my first guest, and she shares some incredible insight and vision about what healthcare marketing will look like in the future. And our next guest is Ann Handley, who I also had a fantastic interview with, who really shared some important things about authenticity and transparency in this new age, as we really need to communicate with people as effectively and as clearly as we can. So with that being said, let's go right into the webinar, which you're here for. This is a mini workshop, and it was designed as a mini workshop. So we're going to get really tactical about how to think about your content right now and how to repurpose it if you need to do that. So we all know that the pressure is on healthcare systems and hospitals to turn their revenue dollars back on. We had to pause for a long time. Obviously, cash flow was a major crunch, and hospitals are businesses, and they do need to turn their eyes now towards getting patients back in the door, both because that's our mission. Our mission is to treat people and make sure that they stay healthy and that they get better, but also because we do need to make sure that we're bringing in revenue so that we can continue to run the business as a healthy business and as a business needs to be run. So when we're thinking about this as marketers and as communicators, what we really want to be thinking about is how are we going to achieve the perfect Venn diagram of content strategy, which is helping the business further its objectives and also answering users' questions so that they can do the tasks that they came to engage with your content to do. And right now, it feels like people are really focused on the questions that they have, and they're looking at a lot of different sources to answer them. So when you're planning for this, and I know you've been hit with a dozen different requests from all sorts of areas, and you're just trying to keep up, we do feel like this content repurpose model that we've used is really, really helpful towards making sure that you're not duplicating efforts or duplicating output. So the first thing we start with is, what information do you need to communicate? What's important to your audience? What do they need to know? And then we want to define them even better. Who are they? What are the questions that they are asking? And how can we make sure that they're getting those answers? Then we want to make sure we're putting them into the right content format for them. So some audiences may respond more to video, some may respond more to text, some may respond more to graphics. And then the last thing that we do is we choose the distribution channels that make the most sense. Where are our audiences spending their time? And this is where you really want to watch your data analytics to make sure that you're putting this content on places where those audiences are interacting and looking for your information. So probably marketers never thought that they were going to spend this much time in an Excel spreadsheet, But you pull up your handy dandy Excel spreadsheet, and it's called the reuse content framework. So this is really the way that we think about it. And the first thing we pick is our audience. So we have to decide who they are. Then we look at the questions that they're asking, the information that they need to know, the format that would most appeal to them, or that we can actually create, because some of us don't have video budget right now, or we can't get into our hospitals. So how can we communicate with them best? And then the channels that they're spending their time on. And again, these things should be focused on the audiences that are going to bring the hospitals and healthcare systems revenue. How can we make sure that we are getting our message out there to the people who not only need our care, but that can also help the business stay healthy and grow? So let's now turn to audience and information. So we pull up a framework again, and I picked 3 different audiences because I thought that they were interesting to compare and contrast. So the first one I picked is returning visitors or patients, expectant mothers, and then plasma donors. And again, these audiences, we're going to find out, have some of the same questions, but they have also different questions. How do we manage that within making sure that we're being efficient with our content production? So I want to talk a little bit about audience and archetypes because they have shifted with the pandemic, and we do need to think about our audience's mindset a little bit differently than we have in the past. So clearly, an expectant mother doesn't really have a choice unless she wants to give birth at home. She needs to come to the hospital. But a returning visitor or patient may actually feel like they have choices. Maybe they can put off that joint replacement. Maybe their doctor told them that they could wait to have that procedure or surgery. Then there are other patients who really can't wait, like patients who have to have infusions and have been suffering because they haven't been able to go in and get those treatments. So let's look at these 4 different audience archetypes, and this is from the Optum COVID-19 Concern Index, and you can see the link at the end of the slide. So the first audience that we have are fearless firsts. These people are going in, it's not that they don't care, but either they need their care more than they're concerned about catching the virus or what the facilities are like, or they just feel comfortable and they feel like they're safe and they can go in and get the care that they need. Then we have the positive pragmatists. So those are the people that need their care, know they want to get their care, and just need that content to help get them over that hump, to assure them that they are going to be able to be safe when they come to the hospital or the physician's office or the infusion center, whatever area that they're going to for treatment. Then there's the reluctant to return. And so those are the people that you're really going to have to convince. You're going to have to produce more content than you would normally produce for the positive pragmatist or the fearless first to really convince them that it's safe, that they can go, that they don't have to worry. And then last is laggards going last. And I think that you should really be spending your time on the positive pragmatists and the reluctant to return. The laggards going last are not going to come in unless they have, hopefully, an emergent condition, because they're just too afraid, or they have underlying conditions, or something is telling them, it's just not safe for me and I don't feel comfortable going. So when you're thinking about where to put your dollars and your time, I think that the positive pragmatists and the reluctant to return, it's their questions that you want to make sure that you answer. So we created this content ideas for different COVID audiences. And the reason I bring it up, and you can download this, we have all of our resources on one COVID-19 page on our website. But the reason I bring this up is because I really want us to focus on the question aspect. People are not coming to your content to read it and get brand awareness. It's just not happening right now. They're coming to your content because they have to do something. I think that's probably true a lot of the time, although when they have more leisure time, they can look at your blogs and your other information that you use as patient education. But right now, these patients need to know what they need to know in order to move ahead with their care. And so we pull up our framework again, and we think about what are the questions that each of these audience segments are thinking about. So returning visitors want to know you're safe. They want to know what happens, what they need to know, what happens when they actually get to the hospital. Are there different entrances? Are there COVID and non-COVID places for patients? What does parking look like? I mean, down to the bare bones. Am I still allowed to use cash? People need to know the answers to these questions. And then of course they want the obvious, hours, appointments, telehealth kind of stuff. Expectant mothers want to know the exact same 2 things. You're safe, what they need to know. But then things change for them because they have a completely different situation. They want to know, you know, when you go into the hospital to have a baby, something, not that you don't when you go in for have surgery, but something radically changes. You now have another human being. So how are you going to treat me as the mother when I'm laboring? How are you going to treat the baby afterwards? Am I still going to be able to have the baby? Are you going to have to separate us if we test positive? Can my partner come with me? How many visitors can I have? These are questions that expectant mothers are going to ask. And then there's the plasma donors, and they're probably not thinking about safety the same way because they've already had COVID and they know that they can donate their plasma to help other people. So they're thinking about they have a different set of questions than maybe your other audiences. Now, here's the thing that should bring you joy. These questions overlap. So these three audiences that are very different have a lot of the same questions. That's why you don't have to keep creating and recreating your content. You can focus your content on general questions, and then as you drill down for those particular audiences, you can develop more specific content for them, what they need to know depending on their situation. Okay, so we know who our audiences are. We know what our information is that we're trying to communicate to them. Now we have to talk about, well, what format is going to really make the most sense for them? So let's talk about what we know right now. We'll literally could hang up from this webinar, or quite frankly, it could be happening right now and none of us know it because we're paying attention. But let's just go with what we know at this moment in time, because decisions are made on the information we have. So people are past the one-on-one. Your focus is now really on acquisition and revenue. I don't think you need to explain what coronavirus is in every single thing that you write. I don't think that you need to give them disease process or symptoms to look for. I think people who are coming to your website or interacting with a lot of your content are really looking for either deeper dives, or they're looking for this operational content, this content that helps them get the care that they need. Some of your messaging is the same as other brands' messaging. There's not a lot you can do about that. I mean, hours and appointments, telehealth visits, how they, happen, that might be a little bit different, but it's basically the same structure. But how do you find ways to be different? Like, we want to tell stories. We're marketers and communicators. We know that people learn from stories. Well, one of the things we're going to talk about is how you actually communicate, how you write and design and create this operational content is going to communicate to people how easy it's going to be to do business with you, to return for care. And this is incredibly important because if you want to differentiate your brand, this is your chance to do it. So people may have thought about going up the block or across town or into a different state. But if you're communicating to them that there's a real opportunity for life to be easier for them when they come in for treatment, that's differentiating your brand. And so there's an opportunity here to get your message out into the marketplace that we're better for you right now, and here's why. Then what I'm going to say is, you're all going to laugh at this if you haven't already read it, but marketing and communication teams should be the single source of truth for content creation and distribution. Okay, I'll give you a moment to laugh. So I know it's a struggle. I know there are silos. I know that there are people screaming in your ears from all different angles. But at the end of the day, if you can get the operational people to write the content and give it to you so you can edit it, you're going to be able to control the messaging around it, and it's going to be better for you and better for patients. Now, again, I wouldn't fall on my sword for this, but if you can try to centralize content creation, particularly around operational content, so there isn't a million different messages out there, again, it's going to make your patients and your returning visitors feel more comfortable. So back to our framework. So we're looking at our returning visitors, our expectant mothers, and our plasma donors. Some of them want to know the same things, some of them want to know different things. And you can see here that I just jotted down the best possible formats for communicating this information. So talking about how we're safe, you could do that in a video, you could do that in a slideshow, you can use graphics and downloadable PDFs and things like that. All of this can be wrapped up in different formats that will appeal to those audiences and that will help them understand what needs to happen for them. This is Miami Mercy, and I think they do a really nice job of centralizing all of their content onto their website. You can see that they make it very easy to navigate down to what you're looking for, and they help their visitors figure out what they need to know. as visitors dive deeper into the things that they might need, they create different content formats for them. And this is important. If you create a video, you still need text to accompany it. One of the great ways to do this is just to transcribe the video, get the transcription, and just write it so that it's more of like an FAQ type of text situation. Not everybody wants to watch a video. I know that I personally sometimes feel like it's dragging on and I just want to get the information and scan to find what I'm looking for. So as many different formats as you can provide would be great, but it's important to remember that telling people this information in different ways communicates trust to them in different ways. There's something really nice about seeing this surgeon explain what people want to know that builds trust in the same way that just talking about it in an accessible, plain language way builds trust as well. And then you can see when you go to their Facebook page, they're using those videos right there on their social media channels. They're putting them out there as a way of pulling people in, because even though it's operational content and it's what you need to know, by communicating that and distributing it across their channels, they're letting people know this is how you can interact with us. It's easy to interact with us. We're making it as easy as it possibly can be. This is Ohio Health. They also do a really nice job of this. It's a little more serious, but I think that that's probably the brand that they're going for. And I think that you can see that they sort of are using these 3 different graphics at the bottom to sort of pull people into what channel they might be looking for. They also do a really nice job of creating videos along with text that explain to people exactly what they need to know. And when you go to their pages, they have a video for almost every accompanying piece of text that you can find. These are great videos that they can distribute on their channels as well. I absolutely love this social media graphic, this graphic that they distributed on social media. I think it's really important. You can put this on your website. You know what's fantastic about this graphic? You can put it all over your hospital. Signage is also really important. Email newsletters can have this information. You can put this in a downloadable PDF and send it out to people, and they can print it up and put it somewhere. It's really important information to have. What I want to point out about this graphic that I loved was I knew that you donned a mask, but I didn't know you doffed a mask. And so they're educating people at the same time that they're making sure that they're being safe and that they know what to expect when they come to the hospital. This is a really effective way to do that. This is an email that I just got today, and I slid it into the webinar because I thought it was so effective. It's LabCorp, and they're just asking me, should you get an antibody test? Is that something that I really need to look at? Is that something that I should consider? And so they're just putting me in the frame of mind of asking me a very simple question through an email, through text, and I'm invited to find out more. Then below that, I'm invited to participate in a clinical trial. So again, they're saying to me, if you want to come in for an antibody test, this might be really easy for you. Let's explore whether or not you're the right candidate. Okay, so probably sick of me saying this, but audience, information, format. Now let's get to the channels that make the most sense for you and your audience. So this was a study that was done by Brandify last year, and I think it's really fascinating for marketers to look at where people are accessing information about where they get their services. So this isn't specifically targeted towards healthcare, but it does tell us something about the way that people search and find the information that they need. You can see a lot of people are looking on Google Maps, and Google has been very sophisticated about giving people additional information that they may need. For example, I can punch in an address and it will say to me, this is closed due to COVID. Or you might get there and it's going to be too late to do business with that place. People are looking on Facebook a lot. They're looking on Yelp, something that I think a lot of us think about but don't think about. Then they're looking at your website, Google Assistant Home, and then they go to Instagram and so on and so forth. So it's important for us to think about not just our website, but other channels that really may make sense. Binary Fountain did a really important study right now about how healthcare marketers are communicating during the pandemic, and they use this great graphic, a perfect example of design that communicates something easily. Email marketing is really popular, phone calls are really popular, text messaging is really popular. it makes total sense. This is how you need to communicate with people inside of your system. But as we move towards trying to pull patients back in and building revenue, we want to also take advantage of our website, of Facebook. And I really think that Instagram is a great place that hospitals should think about being, particularly with IGTV that allows you to do longer video formats. I think that's a great channel to be on as well. And I think we'll see these bubbles change as the pandemic evolves and as patient care evolves. I think it's also important to know that Google has created a healthcare provider set of instructions for search, so you can go right into this and find out what you can do to change your backend code and your structured content to help you. What they've done that's really helpful is when you look up a practitioner, they will tell you whether they have telehealth appointments if that practitioner has supplied the search engines with that structured content and that metadata. So that's also really important to think about in terms of the channels that you select for these audiences. So you come back to your framework. You think about, okay, I know this about my audience. These are the channels that make most sense for these content formats. And I want to make sure that I'm getting out there in front of these audiences. And you can see that for the We Are Safe and What You Need to Know, a lot of those things are going to overlap. And that makes sense because people are looking for the exact same kind of information, but it's the way you communicate that information that is going to differentiate your brand message. The other thing you'll see is that every single thing is the website. And this is a governance issue that I want to talk through very, very briefly. You don't want your footprint for this COVID thing to expand and cover your entire website because it's going to be a total mess to clean up as we move through it and as things change. So timestamp your content, but try to consolidate all your content into one section of your website, and also create a Dropbox, Basecamp, whatever project management software or file sharing system you use, and make sure the content is there and organized well in folders. That will help you later with a governance issue. So that's an important way to sort of keep track of everything you're producing and making sure it's all in one place to make it easier for your patients and your users. Okay, so you have the reuse framework. You know what you need to do now, but you need to differentiate your brand somehow and you need to make it easy. So how do you do that? So let's just talk. Anybody who's been to one of my webinars knows that can't have a webinar without some neuroscience information. So let's talk about the way that memory works. So and this is important to designing and making it easy for people to come back to your organizations. So there's sensory memory, brief snapshot in time, working memory, which we're going to focus on right now. It's where we keep short bursts of information that we need to know. So if you think about the old telephone numbers, they were 7 digits. That's because the brain can really only handle 5 to 9 items. I think we're going to lose that eventually because technology is going to help us do that. Like, for example, now when you get a security code, my phone will just automatically say, like, do you want this code? I don't even have to remember the numbers anymore. But that's basically what our brain is capable of holding for a short amount of time. And then we obviously imprint long-term memories with significant events that happen to us. So think about how your audience is using and interacting with your content. There's all this cognitive load, right? The brain has to work really hard to keep all these different things going at once, right? Scanning the web and getting information is like the ultimate multitasking situation because you have to read and comprehend, you have to click, scroll, and type. There's loading times you have to wait for. You might have to fill out forms. Pop-ups are getting in your way. You have to click through a lot of windows. So when we talk about making life easier for your patients or your audience members, we want to do as much as possible to lessen this cognitive load. If it's hard to read, we assume it's hard to do. This is from a UX researcher. So we talk about plain language all the time, but today I'm going to focus not only on plain language, but design and decluttering of your messages and your operational content so that it's easy for people. You're communicating to them. This is going to be the easiest way for you to do business with us. So you want to be clear and specific. You want to use step-by-step instructions, and you want to use visuals and designs as well as possible. So let's talk about clarity. So this is a visitor restrictions to prevent the spread of COVID. This is what it looked like before. We redesigned it to make it much easier to look at. Look at this slide. You could use this in a million different places. You could use this on Instagram. You could use this on Facebook. You could use it on your website. You can send it out in your emails. Just the fact that it's organized in an easier way for people to follow is a critical part of what we're trying to accomplish here. And it can be reused and repurposed. So you have the longer content here that's kind of hard to weed through, but when you see it in the design format, you could go back and change those FAQs and make them easier to understand as well. This is just a hot mess of information coming at you. Attention, important notice to all visitors, right? My amygdala is already on fire from everything that's going on. You don't need to scare me more. Again, easy way to see it, easy way to get through the information that you need. When I first saw this, I was like, who can donate? Are you asking me for money? But it's really about donating plasma. And so this is so much easier to look at. And again, a piece of content that you can use in a million different places and in a million different ways. Okay, so that's being clear. Now let's talk about breaking it down. So when people are thinking about what they need to know in order to do something, that working memory part, we want to make sure that we make it as clear to them as possible. But more than that, that we communicate to them, this message is for you. That's why our H1 page titles are so important, because when people land on a page and they read that intro paragraph, that's what we're trying to say to them. You've landed in the right place. So when people see this pregnant woman, they're going to automatically know this is for me or my partner to understand how we are going to interact with this organization that we're coming to for our healthcare. And there's no more than 5 things here. We're not creating more cognitive load on people. So we've broken it down, we've given people clarity. Let's look at a step-by-step situation. So here are the 5 things that somebody needs to know, but they're kind of buried inside all of this other content. So what if we just made it very simply, step-by-step, this is what we are doing to make your life easier. Again, piece of content you can use in a million different places, and something that is really going to be something that you can use over and over again in a lot of different ways. Signage, slideshows, social media channels, everywhere where people might interact with you. And this is also brand messaging, because it says to people, this is what we're doing, and we're taking it really seriously and we're being clear about it. And then the last thing I want to talk about is using visuals and design. So there's like a lot of information here, and I don't really want to go through it all. This is a lot easier. That information was about getting tested for COVID-19. The lab specimens tell me that this is about getting tested because it's blood. Those vials on the right-hand side, I have 4 steps I have to know and understand. They go in order of what I need to expect and what I need to know. Easy to use and understand. Okay, this is a classic example of we need to get this up and we didn't spend any time editing this or thinking about what people need to know when they read this stuff. Easy. We're trying to tell people about visitation guidelines. Here's a picture, pretty calming picture, right? Like the balloons. The only problem with it is there's more people around the bed than should be, but it is a visitor showing people this is about visitation. So you're in the right place. Let us explain to you what you need to know. Here's the information that makes it a little bit different. These are FAQs. These are actually really good FAQs. They're really written very well. There's a lot of them, and they're not organized according to that cognitive load rule, only 5 to 7 items at a time. So this list should be broken out with corresponding questions that have to do with each other. What if we made it a lot easier to read these FAQs? Basic questions answered, questions about our hospital answered, questions about antibody testing answered. That way of thinking of breaking apart information and using visuals and design wisely. And last but not least, again, another example of how you can just make it easier for people to understand what they need to know. So to sum up, because I know I'm at my time and we want to hit questions. Plan by audience, information, format, and distribution. You've heard that 75 times. Could play a drinking game, drink every time I say that. Tell your story by differentiating your operational content and make it easy to use and remember. Make your website one source of truth so you don't create a governance nightmare later on, or other people don't create one for you. And if you can consolidate communications through marketing and communications, life will be easier. When the pandemic first hit, we created a plain language cheat sheet for the first terms that emerged. Now more terms have emerged, so we've created a part 2. Again, you can download that, and I think it will be available, the link, when we send you an email with access to the recording and all the other stuff. I'm excited about these. They're filling up fast. You can ask Ahava anything, 10-minute chat. Just go to that URL. That'll also be available in the email, and you can just sign up for 10 minutes. I had a really great conversation with somebody yesterday. It was supposed to be 10 minutes long, lasted for 30 minutes. It was great. She learned a lot. I learned a lot. So if there's anything you want to ask me, please feel free to sign up for that. And with that, we will turn to questions and answers.
Okay, Ahava, our first question, how do we prioritize what content to develop?
So really it's the business. What is the business like dying for? Like the first thing is, I shouldn't use that word. The first thing is like getting elective surgeries back in, right? So joint replacements, not really elective if you're in a lot of pain. Thinking about people who need to come back in for infusions. What are the really basic core principles of the business that's going to get it back on its feet, and how do we do that? The other thing is that leadership should really be telling you this. These are our priorities for the next 3 months. These are the people you need to get back into the hospital.
Okay, this one. Normally we create different content for different social channels. In the case of informational content for COVID-19, do you think it's okay to post the same content but tweak it very slightly for the different social channels?
Yeah, so it was really interesting. When I was looking for examples of this, it was actually really hard to find people who were doing this well. But what I did notice was that some people clearly had a content strategy for different social channels. So the best example that I saw was Johns Hopkins. It's very clear to me that their Instagram channel is about championing their healthcare workers and their internal audiences. They use it for their external audiences also, but it's really more of like a platform to talk about what they're doing within the hospital and that health system. If you go to Facebook, it's really focused on distributing their research, talking about their consumer stuff, answering people's questions about sleeping and things that are coming up right now, you know, mental health issues. So if you have a clearly defined content strategy for each of your different channels, and you should, then I think that you do want to do exactly that. You want to take your operational content and just tweak it slightly for that particular channel. So I would agree with that. Again, you're not going to use every piece of operational content on every channel you have. The point is to create one source of truth and then use that in different ways depending on what the format, what the information, what I'm lost, what the information is.
Okay, this one is from a children's hospital. I'm at a children's hospital and we are trying to increase our emergency department visits. Parents are hesitant about visiting emergency departments right now. How can we reassure them?
So the number one thing that I think you can do, I don't know how you do this, is to maybe capture parents talking about this, either taking a picture and posting a short story. I think having doctors talk about all the precautions that they're doing. I also think for a lot of moms and dads, they're thinking about what's going to happen when I bring my child in. So almost walking them, you could take pictures and do a slideshow. That's a pretty cost-effective way to do this. Or you can do a quick video where you just walk through the pediatric emergency department or the emergency department and show people you're going to get there, you're going to have a mask, you're going to be separated over here. I think just walking people through what it's going to look like, I think will really make people feel more comfortable. The other thing is that we really need to educate people. I mean, you can't not bring your kid or anybody else in for an emergency. And there's a terrible story from a health system out in the West Coast where a patient was having a heart attack in a telehealth visit with a doctor, and that patient ultimately died, even though the doctor begged them to go to the emergency room. So I think in general, we need to educate people better about you can't wait for certain things, you've got to go in. But as much as possible, making it clear to them what's going to happen is going to alleviate their fears. A little or a lot.
Do you have a recommended frequency for posting those operational content infographics you showed? Is it okay to post that type of information more than once?
Yes, absolutely. I think that that's part of your editorial calendar planning. So I think posting it, depending on the channel and depending on who you know your audience is for that channel, I think you can absolutely post it 3 times a week. I wouldn't post the same thing 3 times a week. I would try to find, you know, 7 or 8 different types of operational content and post them throughout. And then again, tweaking it a little bit. So if you write something for adults, you can easily, well, not easily, but you can tweak that for children. So just thinking about it from that perspective, I think is a good way to know that you can get, you want to squeeze the most juice that you can out of every piece of information you're creating a corresponding piece of content for. But absolutely, you can post it more than once.
You mentioned marketing being the single source of truth. Any tips on how to govern this content or how to manage this with other communications teams at our organization?
Yeah, so Amanda gave a really great example about how at Cleveland Clinic they created Slack channels for different people, and then the directors had one Slack channel. So if something needed to be approved, one director could post it, and then another director who had to approve it or look at it could do it really quickly. So I think that's one way to do it. I think writing up a certain set of standards, just a fast and quick, I hate to call it dirty, but it's a fast and quick governance standard of like everything gets posted on the website, everything gets put here. We have to follow these plain language guidelines when we're writing. These are the terms that we're allowed to use. These are the terms we're not allowed to use. I think that will help in terms of governance. And then of course, going back to your strategy, if you're a brand that's focused on creating news that intersect with healthcare, then you don't have to stop writing those blogs, but you want to find a way to weave the business into them and make sure that you're getting across to people, this might be news you can use. And by the way, you can come in and get this service from us. For example, cancer hospitals are now focused on, you must come back for your chemotherapy and radiation treatments. You cannot wait on those. And there's all this news coming out about how delaying this could potentially be dangerous. People who are thinking about their infusions, same idea. So just making sure that you're making it clear to people that, it is safe when they come back and they do need to come back.
Great, that was our last question.
Okay, wonderful. Thank you so much, everybody, for being here. It's always a pleasure. You will get an email with all the information afterwards. I look forward to seeing you at Ask Ahava Anything, and I really hope you do enjoy the What Did You Learn series that we're going to be releasing. And just so you know, this is the ways to contact me. There are many of them, and I look forward to interfacing with you at some point in the future. Thank you so much.